It's time now for A Week in France, our roundup of the major headlines making French news over the past 7 days. French President Emmanuel Macron has pledged to keep fighting for the release of a sports journalist jailed in Algeria. On Wednesday, an appeals court upheld a 7-year prison sentence for Christophe Gleizes, who was convicted of glorifying terrorism. He was arrested earlier this year after interviewing a football official that Algerian authorities say has ties to a banned separatist group. It's a blow for Gleizes and his family, who had high hopes of an early release in the wake of improving French-Algerian relations. Reporters Without Borders has strongly condemned the court's decision.
Christophe Gleizes is the only French journalist detained abroad. He's been handed the heaviest sentence ever handed down to a French journalist in the last 10 years. And I ask you, how are we supposed to explain that journalism is not a crime? Why can't the Algerian justice system understand this?
France's Food Safety Agency has found that 90% of the country's drinking water contains the forever chemicals known as PFAS. The report analyzed more than 600 tap water samples and an equal number of untreated water samples over a 2-year period. Meanwhile, another study following on the heels of this one has found that breakfast cereals, bread, and other cereal-based foods here in Europe are also heavily contaminated with PFAS. The report, published by Pesticide Action Europe, a coalition of more than 600 NGOs, says pesticides are the source and that urgent action is needed. August Hackinson reports.
It's a stark new warning. According to Pesticide Action Europe, many of Europe's most popular cereal-based foods are contaminated with so-called forever chemicals, PFAS. One of the most common, TFA, was found in more than 80% of samples across 16 countries. TFA turned up in breakfast cereals, sweets, pasta, croissants, whole grain and white bread and flour, often at high levels.
All people are exposed to TFA through multiple pathways, including food and drinking water.
PFAS are industrial chemicals used since the 1950s. They can take hundreds, even thousands of years to break down. Once they leak into soil or water, they can linger for generations. The new study came just 1 day after another alarming report from France's Food Safety Agency. It found PFAS contamination in 92% of drinking water samples collected over the past 3 years.
The presence of PFAS in drinking water is still insufficiently understood. Only a few of these substances are currently monitored.
In recent years, the health risks have become clearer. Some PFAS chemicals have been linked to serious illnesses, including cancer. Campaigners are now urging governments to ban all PFAS-based pesticides and other major sources of TFA.
To discuss these reports further, we can now bring in François Veillerette, the director of the NGO Generations Futures and former president of Greenpeace France. François, thank you so much for joining us on the program today. Now, before we get to the details of the report, as an expert on chemical pollution and pesticides, I want to start by asking you if you could explain to our viewers what PFAS and TFA are and how do they work. I mean, we call them forever chemicals, but what does that really mean?
PFAS is a large, very large family of chemicals. There are more than 10,000 different chemicals in this family. It's a huge family of and polyfluoroalkyl substances. It means that, it are long-chain chemicals with carbons and fluoride. And TFA is one of them. It's a very short chain PFAS, one of the smallest, and it's a breakdown product of some pesticides and also of F-gases and a few pharmaceuticals. And it's found to be about everywhere in the water in France and in Europe.
Now, so to go back to this report, it sounds pretty alarming. The takeaway, 90% of France tap water is polluted with TFA, one of those forever chemicals that you were just explaining. Is this report as bad as it sounds, and what conclusions can be drawn from it?
It's quite bad because the concentration of TFA in the ANSES official report is quite high. It's a bit over 1 microgram per liter. And considering that TFA is considered officially as a relevant metabolite, it means dangerous metabolite of pesticide, it should be not found over 0.1 microgram per liter. This is the limit of quality in Europe, but the actual levels are, the mean level is about 10-fold this 0.1. So it's well over this quality limit. So it means that huge efforts will have to be made to reduce dramatically this level of TFA in waters in France and in Europe.
Now, as the report said, they looked at treated, filtered water that comes into the tap in the home, untreated water, and didn't find much of a difference. So what can be done? Is there a better way to filter the water to remove these?
The problem is TFA, that it's a very small molecule, so it's very difficult to filter. You have to use inverse osmosis to be efficient. It is efficient, it can filter TFA effectively, but it's very, very expensive. So it will cost millions and probably billions to treat all the water for TFA. So it's not realistic to do that everywhere on the territory. The only practical solution is to reduce the use of the chemicals that produce TFA in the environment, that is, these fluorine gases, and especially in the French countryside, there are about a couple of dozens of fluorinated pesticides that do produce TFA. So these specific pesticides will have to be taken out of the market for a better efficiency.
Okay, so if one of the conclusions we can draw is to stop using some of these chemicals, pesticides, but what about what's already in the environment now? What are the risks there, and what are the risks for people's health?
The problem with TFA is that it's considered now as toxic for the human reproduction. And it's quite clear now, and the German state proposed an official classification to the EU as a toxic for reproduction. Category 1 means probably toxic for reproduction. So this is a very high category, and we are still waiting for the official outcome of this demand from Germany, but it really shows that this is a dangerous chemical. So we really need to take action to have this level of TFA disappear of French waters and European waters. But the situation, speaking of the second report on TFA in several products, is even worse in food, because the level of TFA in these several products is even higher. It's about 100 times as a higher concentration as in water. So it shows that urgent action is really needed to protect water and our food from TFA.
Now, as you mentioned there, urgent action is needed. So while the EU looks at regulations taking some of these, toxic pesticides out of production, what can the general public do in response, and how can they protect themselves against these risks?
Yes, some countries have already acted, as Denmark. They've taken out this specific pesticide out of the market. So now we need a more global EU-wide action. Well, it's not so easy for individuals to act. You can buy, the special inverse osmosis filters that you can adapt on your tap, but they are expensive, and not everybody can afford that. So really, even if these individual actions can have some effect, what we need is a global action from the European authorities to ban these specific PFAS pesticides so that they stop producing TFA all over the continent.
François, thank you so much for joining us on the program and sharing your expertise. That's François Veillerette, the director of the NGO Generations Futures. A town in central France is putting its money where its maternity ward is, offering new moms a cash boost just for giving birth locally. It's an unusual incentive with a very clear goal: saving the town's maternity unit from closure. Charlotte Lamb explains.
Talk about good timing for this new mum, even if her daughter didn't quite stick to the plan.
She's the first one. She came out early. It wasn't a choice.
She gave birth here in Saint-Amand-Monton, and she's leaving not only with the newborn, but €1,000 in vouchers. To save the town's maternity ward, its mayor has introduced a new initiative.
€1,000 bonus for any mother who chooses to give birth in our maternity ward. The goal is to prevent mothers from going elsewhere. We have an amazing maternity unit here in the town of Saint-Amand.
The ward recorded just 237 births last year, with even fewer expected in 2025, far below the 300 required to stay open. So local officials stepped in.
Why not? If it can make life easier for families in a tough economic climate in France, I think it's a good idea.
The mayor is hoping the financial nudge will help push birth numbers back up. The initiative unfolds against a backdrop of dwindling rural healthcare in France and widespread maternity ward closures. But some medical unions oppose it, saying choosing where to give birth should not be influenced by financial reward. Still, for these new parents, it's a welcomed bonus.
Back here in France, Lyon's Festival of Lights kicks off the holiday season. The eagerly awaited event features intricate light displays projected onto historical monuments and public buildings across the city. The 4-day extravaganza draws an average of 2 million viewers from all around the world. Around 20 installations have been created by both French and international artists.